The World Health Organization says a steep decline in Mpox cases means that it is no longer a global health emergency. The outbreak started, you might remember, last spring, mostly among men who have sex with men.
There were about 30,000 cases in the U.S., but fast distribution of Mpox vaccines reduced new cases dramatically.
But now the Centers for Disease Control is reporting a new surge in cases. Ground Force Dan Kerman reports.
The Mpox virus, which is transmitted with skin-to-skin contact and causes rashy lesions and flu-like symptoms, is on the increase in parts of the nation. The Centers for Disease Control is investigating new outbreaks with special focus on Chicago.
Most of them were vaccinated, but on the other hand, none of them had a lot of pain, which was the hallmark of bad Mpox in last summer. None of them were hospitalized. They were pretty mild cases.
Despite those vaccinated getting infected, medical experts say the reduction in serious disease is reason enough to get the two-dose vaccine if you haven't already.
One category of people who we want to reach are those who only got the first dose. And we really want to encourage people to come in and get their second dose. They don't have to start the series over. Even if it's been, more than 28 days or many months since the first dose, they can just go ahead and come in and get the second dose. And then in addition, we are encouraging those who have not received any vaccine, but may be at risk for Mpox to get the vaccine.
While San Francisco hasn't seen an increase yet, it's one of the big cities across the country pushing to get those most at risk, which includes men and trans people who have sex with other men, to get the vaccine now before Pride season gets underway.
It takes 2 weeks after the second dose to reach peak immunity. So knowing that the second dose is 28 days after the first dose, that means people will have peak protection 6 weeks after they start the series.
Experts say it's likely there will be a surge, but how big is dependent on several factors.
It's a threat that can be mitigated or modified based on, number one, getting that vaccine or, having that honest conversation with partners that you're with.
Vaccination sites can be found on the San Francisco Department of Public Health's Mpox page. Dan Kerman, Cron 4 News.
Ahead